I'm Liz.
Hi, I'm Josie. We're both practicing nurses in Massachusetts, and we're also nursing faculty at Endicott College in Beverly.
So I've held many roles in nursing education, including administrative roles and also accreditation positions.
And I've had a lot of different leadership roles in nursing practice, including staff education and some supervisory roles.
So we all understand that nurses aren't ready for practice. That's not news. And there's a lot of research supporting that. So we recognize that our combined experience put us in a position where we could really get creative and innovative in ways to teach our new nurses so that they are ready for practice.
We know that new nurses are expected to hit the ground running, but there's not enough resources in practice anymore to support them when they get there. Experienced nurses are leaving, and there's just not enough preceptors and qualified educators in practice settings. New grads really need to be confident in their clinical judgment skills before they get there.
So with the recent focus on clinical judgment in nursing education, we found that it was being taught and measured really effectively in the simulation setting and the clinical setting, but what was missing was what people were doing in the traditional classroom setting. So what we did was we created a course that was modeled after Chris Tanner's clinical judgment model.
Since we're both practicing nurses, we really knew that Tanner's model captures the way that nurses think better than any framework we've ever seen before. It really makes the implicit work of nurses explicit so that it can be explained to a student. It describes clinical reasoning in a tangible way that a novice nurse can really grasp.
So in order to transform our traditional classroom into a practice environment, we put students into teams and we had them collaborate on decisions using a video case study that was facilitated by us.
We really wanted to promote teamwork and collaboration. It's a realistic and it's a useful practice skill. The progression of cases became really dependent on students' choices. They demonstrated their ability to reflect in action, and they engaged in flexible thinking. We presented them with unexpected clinical curveballs, and they had to respond to it.
So reflection on action discussions were done after the activity, and the students' responses to those indicated that they initially felt anxious about choosing the correct answer. That was their focus. So they preferred to do nothing rather than make a mistake. However, as their confidence grew over the course of the semester from doing this activity every week, they began to reflect that there were many appropriate actions to choose from, and the best action for an individual client was really based on the context of what was happening in the moment. We also saw improvements in their performance on examinations. We created case-based examinations that were unfolding scenarios that followed the NGN style NCLEX blueprint. And students also used the course evaluations at the end of the semester to share that this was the first time in the curriculum that they really felt like they were thinking like a nurse. And many of them reflected back on this sort of being a turning point for them in the curriculum from taking very concrete thinking and then turning it into a more flexible thinking that they thought was a better demonstration of their knowledge.
It was really cool to see. So if you want to try this in your classroom, what we recommend is, first of all, making your classroom a safe and judgment-free practice space. The important thing is to create a relationship with your students that allows them to really be able to learn from their mistakes. They can't be afraid to fail here.
And we also want to emphasize that you should guide your students to understand that there is more than one way to approach a problem. And patient-centered care is based on the fact that every patient is different and should be treated that way. So allow them to make their own decisions based on the situation, and then give them the opportunity to defend those choices that they've made.
And we think most of all, be flexible and have fun with this. This activity really has the most value when the educator has the ability to cope with ambiguity themselves. You need to be willing to facilitate learning in whatever direction the students are going to take you. Nurses have a unique opportunity to connect with individuals, and we know that practice is not a one-size-fits-all approach, so we can't expect the methods that we use in the classroom to have a one-size-fits-all approach. The ambiguity and the flexibility is what keeps practice exciting. We're the coaches that can share that joy with our students, so don't forget to model the joy.
And Josie and I have spoken a lot about how this is the most fun that we as educators have had teaching a course in our entire careers. The students are engaged, we're engaged, every class is different, and it's just really rewarding to see a classroom space really take on the shape of what you see when you're practicing nursing in the clinical environment. So the nice part about this activity is that it can fit any course in your curriculum as long as you adjust the content, that that's being delivered. And then students, like I said, reported that they found it both challenging and engaging. So we do hope that you try it out, and please connect with us and let us know how it goes.
Thanks.
Thank you.